Hey you guys, so I just wanted to take a few minutes to pop in and talk to you about something that's been concerning me in the last couple of weeks. So lately there seems to be an overwhelming flourishing of this particular topic within a lot of the endo communities that I belong to, and a lot of the sorry guys, I'm just muting my phone here so we won't get interrupted with all of the notifications. But the topic of surgery and recoveries and activities and what can I do and what can't I do following surgery has been a big topic lately. And I've been hearing some things and seeing some things from a lot of my sisters that have been quite concerning. And so I decided to just hop on really quick and do a quick video to give you ladies a little bit of tough love and a little bit of advice to help you as you navigate your way through your surgical recovery. As most of you know, I am gearing up for my next surgery a week from yesterday, Tuesday, May 1st. I'm going to be having a hysterectomy for my adenomyosis and also I think my third excision surgery for the endometriosis. And one of the things that you ladies need to understand is even with all of the technological advancements with regard to surgery, and we're not having to stay in the hospital for weeks and weeks at a time. Most of us go home within 1 or 2 days, or sometimes even the same day. You still had a major surgery. Even though now laparoscopically the incisions are very small, you're not cut open from end to end a lot of the times like they used to do back in the day, but you still have had major surgery. Your insides, your organs have been moved around, they have been shifted, you have been cut, you have been stitched up on the inside. So there has been a lot going on. And even though we may start to feel better in a couple of days, there's a lot of healing that needs to take place. And contrary to popular belief or guidelines that have been given back in the day, studies are now showing that with hysterectomies or, pelvic surgery, sometimes it can really take months for you to fully heal on the inside. And sometimes up to a year, depending on the things that you had done. So, be mindful of that. You've had surgery. There's a lot that has gone on inside. The other thing I want to take note of is a lot of the times the anesthesia that they use for us, even though we wake up from it, a few hours later from the surgery, that anesthesia can linger and stay within our system for up to 7 to 10 days after the surgery. If you couple that with the pain meds that they give us after surgery, our system is being kind of shut down and numbed to the true effects of the pain and the soreness and the tenderness that our bodies are actually experiencing. So after the first couple days of surgery, you may start to feel better on the outside, but you really don't have a true indication of the pain and what's actually happening inside of our bodies, and that can lull us into a false sense of, oh, I'm okay, I'm feeling better, I can get up and start washing dishes and cleaning and vacuuming and hauling groceries around. No, I'm going to need you to sit down, take several seats. You need to rest. Don't let the medications and the anesthesia, fool you into thinking you are feeling much better than you actually are, especially within those first, 7 to 10 days following your hysterectomy or your surgery. The second thing that I want to point out to you ladies is I know that this disease can be life-shattering. It can be life-changing, and everything that we thought that we knew about being normal can be totally flipped upside down and put on its head. And for a lot of us, and I know that this was the case with me following my first surgery, you think, even though you have the education and the information, somewhere in your mind you're thinking, okay, I'm going to have this procedure done, whatever is in me that doesn't belong, they're going to yank it out, take it out, cut it out, and boom, I'm going to be back to my normal self and my pre-diagnosis life. And that's just simply not the way that this works. For many of us, it takes months, years after diagnosis and several surgeries to understand that we have to redefine what our sense of normalcy is. For many of us, you'll never be able to go back to the way you used to be before your diagnosis. Not 100%. A lot of us get close, and some of us do get there. Don't get me wrong. A lot of us do get there. But I know it can be mental and emotional, a desire to, I need to get back to my sense of normal, so let me get back to my normal activities. I've had ladies in some of the groups to say, I'm 6 days, 7 days post-op. Can I start swimming? Or I want to start back cycling. Or, I'm 3 days post-op. Can I, vacuum? No, and no, ladies. Sit down and have several seats. You're healing. Your body needs rest. Not to be swimming, not to be cycling, not to be, rock climbing. And again, I know it's emotional. You want to, as quickly as possible, get back to what you feel is your normal self. But this is a time to be still. Let your body do the work that it needs to do internally so that you can complete the healing process in full, and so that you can regain as much as, your pre-diagnosis or pre-surgical activity life as, what you had before. So don't worry about trying to get back to normal. Just focus on this being a time of rest, restoration, mending, refocusing, and just kind of, focus and think about yourself. I know some ladies have children, you have, spouses, and a lot of ladies are like, how am I going to, deal with the kids, and can I, pick the kids up and play with the kids, and all of those kind of questions. And again, big no. Most doctors recommend no heavy lifting, anything more than a gallon of milk for the first 8 to 11 weeks. So if at all possible, if you have a mate, if you have a spouse, if you have friends or family that you can ask to come, support you at this time, to kind of pitch in and take over some of those activities for you while you're recuperating, that would be ideal. And of course, I know that every woman's situation is different. You may not have a strong village. You may not have a strong support system. But as best as you can, try to alter these things. See if perhaps maybe your kids can partner or carpool with a neighbor or a classmate during that time. If you want to, meal prep ahead of time before going into surgery, if you're worried about things like snacking and meals for the children. If you have older kids, maybe try getting some things that can easily be put into the oven or the microwave to take, some of that burden off of yourself. And those of you that do have a partner spouse, let them take care of the cooking and the meal prep and getting the kids back and forth to school and things like that. Another point, some sisters are like, oh, I'm 3 days post-op and I tried to do some vacuuming and some sweeping, and oh my God, I was in bed for the next 10 days. Again, it may seem like light activities, but you're standing, you're moving, your abdomen, your core, all of those things are engaged, and this should be, again, a time of rest. Don't worry about the housework. Forget about the laundry piling up. Forget about the dirty dishes in the sink. Those things are okay. It may be a little uncomfortable or annoying, maybe even to, your partners or your kids. They'll get over it. If it's that much of a problem for them, they can pitch in, they can do the laundry, they can clean up, they can do the dishes. It's a collaborative effort, if you don't have those support things in place, some of the things that I do, try to do all of your laundry before going in to surgery. Those first few weeks, you're probably going to be wearing pajamas, loose clothes, house coats, caftans, things like that anyway. So you have a limited, wardrobe. If you can, get all of your laundry, that you need immediately done beforehand. Get paper plates, paper cups, plastic cups, paper towels, and keep them close by. That was one of the things that really, really, really helped me. So you don't have to worry about dishes. The kids, the husband, the spouse, the whomever, they will not die. They will be okay eating on paper plates and paper cups. for a few weeks while you get it together. So again, do not beat yourself up about the housework is falling behind. You're healing. And if you get up and if you move too fast and if you do too much too soon, you're going to suffer a setback. You're going to be annoyed, especially if you end up back in the hospital or suffering a setback. I know that happened to me in my very first surgery. The first week out, the grocery store was right across the street from my house. I thought, I'm fine. I can just walk. I'm just walking over there and walking back. No, I suffered a major setback. I almost ripped one of my stitches, and I had to get somewhere and sit down for like 2 weeks. I couldn't move. That was enough for me. So now I'm using that experience to encourage you ladies in the same way. So, that mental sense of wanting to get back to normal is a big thing for us. Wanting to do the housework, because you don't want to feel like you're being lazy or not being useful. And you're not being lazy, ladies. You're healing. You are recovering. You're taking time out for self-care. Do not let that little voice in your head drive you crazy or make you think that you should be doing more or doing something. You're doing exactly what you're supposed to be doing, which is healing, resting, and recovering. So another big thing a lot of the ladies talk about in the groups or has come up of late is sex. A lot of ladies are like, oh my God, do I really have to wait 6 weeks before I can have sex? Now, with regard specifically to hysterectomies, a good resource to visit, ladies, there's a website called HysterSisters.com, HysterSisters.com. That's a great resource if you're needing to have a hysterectomy. And that's the biggest question. My doctor said, I needed to wait 6 weeks and it's been 6 days and oh my God, I'm so wanting it right now. Well, the plus side of that is great. A lot of women find that sometimes after a hysterectomy or after they get relief through their excision, they do find that their libido is just like insane and through the roof. And that's a good thing, because on the flip side, a lot of women, their sex drive, their libido does drop. It does decrease, and it may take months or take, a while for them to get back to feeling the need or the interest to want to engage intimately that way. But for those ladies who, it's immediately following the surgery and you're really wanting to get back to it, no. Have several seats. And here's why. Even though, again, you're feeling better, a lot of times with hysterectomy, women have what's called a vaginal cuff, and within the vaginal canal, in the tunnel space between the uterus and where the uterus used to be and the vagina, there's called a vaginal cuff. There are tons of stitches in that area, and those take a very, very, very long time to completely heal, 12 weeks or more. Engaging in sexual activity prior to that time, you have a high propensity to tear those stitches. That includes vaginal and anal sex. You don't want a tear in those stitches. In your post-op visits, your doctor will do examinations and he can determine when and if you are fully healed. So, no sex. For some women, with regard to excision surgery, having sex, when you orgasm, that induces uterine and internal contractions, which can be very, very, very painful for a lot of women immediately following surgery. So, it feels good those few minutes while you're engaging, and then you get to this powerful climax, which is supposed to be wonderful, and then you're pain, and then you're in agony, and then you start spotting, and then you start bleeding, and then you're like, oh my God, I feel worse than I did before. It's really not worth it. The other thing to take note of is you're very open, you're very porous, at that time, both vaginally and anally, while you are healing, and you're more prone to bacteria infections, yeast infections, UTIs, urinary tract infections, and that is with penetration and especially with oral sex. Teeth, mouth, lips, tongue, toys, all of those things, fingers, can introduce bacteria into the vaginal or anal cavity. And the last thing you want to deal with while you are also recovering is a yeast infection or a urinary tract infection or any kind of, infection. So as much as you may want to, as much as he may want to, please follow the doctor's instructions with regard to that. And ladies, you know, if you're feeling pressured to engage in sex before you're feeling better, which I've heard from a lot of women, your man has two good hands, and there's several resources available for him to go and take care of that. And I'm just going to be honest, you should, during your recovery time, the last thing you should do is feel pressured. The last thing you should do is feel bullied, you know, into engaging into intimacy before you're ready, you know. And if you're ready, again, think about after those 35, 25, whatever, you know, hot minutes of, you know, getting it in is not generally going to be worth the pain, the setbacks, the extension to your recovery time that you're going to have to deal with afterwards. Last month during Endometriosis Awareness Month, when we had our online intimacy workshop, we offered some amazing resources on how you can engage in intimacy when penetration is not an option. The post is pinned to the top of the page. You guys can take a look there. We talked about the brochure, Endometriosis, Sex, and You. If you guys want to check out Early to Bed here on Facebook, you can either go to their Facebook page or their website, and they offer tons of resources on how to engage in pleasurable intimacy without sticking one body part into another body part, which can be very not detrimental, but very how can I say, what word do I want to use? Very not welcomed during your recovery time. So again, like the brochure that I talked about, there's tons of resources, non-penetrative options for you guys to engage in all types of intimate play, foreplay activity that doesn't involve penetration. So take this time to redefine your intimacy, explore avenues of intimacy that you maybe had not before, you know, reconnect, expand, expound your definition of intimacy and sexual pleasure. Again, that doesn't involve doing this in some kind of capacity, because, you know, that's, for most women, is more harmful than helpful. And that's the biggest thing that I've noticed is the sex conversation. And again, you should never feel pressured to do anything. Sex, housework, socializing, you know, your girlfriends want to come, you just may not be up to it. Sometimes just sitting in bed, you know, can be exhausting. The medications, your sleep cycle is all thrown off. You know, recovery, it's a very complicated time. And so the biggest thing that I want you ladies to understand is that you're not being lazy. For people like myself, entrepreneurs, people, self-employed people who are used to working and being productive, it is a legit struggle, and I get that. You know, I've been in bed for 6 days doing nothing. I'm so lazy. There must be something that I can do. Can I put my laptop in the bed? Can I walk over to the computer? I just need to do something. What you need to do is go have several seats so that you can recover and rest and heal yourself. You are not being lazy. You are engaging in self-care, resting, restoration, and healing. And I can't say that enough. I just want to give some guidelines. I found this in one of my support groups, and ladies, EndoSisters, you guys may have seen this chart pinned or posted in the groups, and the source, the site source isn't on here. So if any of you ladies are watching and you know the site source for this, jump in the comments and let me know, because when I provide resources, I always like to try to provide a source, you know, of credibility so that ladies can follow up on their own. But the chart here is post-op recovery guidelines. Now, this is specifically with respect to hysterectomy. And of course, obviously, ultimately, I am not a doctor. You do want to check with your doctor for these activity guidelines, you know, based on your unique condition and your unique procedure. Generally, before the surgery, when you guys have your post-op consultation with your doctor, they will give you a list of guidelines: when you can resume walking, when you can resume showering, when you can resume sex, when you can resume heavy activity, exercise, and things of that nature. So just be reminded, this is just a general guideline. Obviously, your specific situation may differ, and ultimately, you know, me not being a doctor, this is just for educational purposes. You do want to follow up and confer with your physician or your team for your specific situation. But just to go over the guidelines here. So again, most hysterectomies have up to a 12-week recovery or longer. So most doctors do advise immediately after surgery, especially because of the anesthesia and a lot of the gas that gets trapped in us. Walking the first week, yes. Exercise, light exercise, which is when we say light exercise, we're talking about walking. You can do that at any point within the first 12 weeks. But let's note, when we talk about walking, we're talking about maybe walking from your bedroom to the kitchen or to the bathroom, you know, or walking around the house, you know. We're not talking about walking, you know, a 5-mile walk or hopping on a treadmill, you know, doing a 12K. That's not what we're talking about. We're just talking about light walking, very ginger movements, just to get things moving around, to release that trapped gas, and also to keep movement and activity within the limbs. You know, sitting, laying too long can get swelling in the legs. You can get stagnant. You can get that temporary sciatica, numbness, tingling, and things of that nature. So yes, walking. Things like going from your bedroom to the kitchen to maybe make a cup of tea or a cup of hot chocolate. No alcohol, but yes, you can get up and walk to the kitchen, make a cup of tea, walk back, sit up for a few hours, you know, maybe take in a little bit of television. With regard to light housework, and the example that they give is something as simple as wiping off a counter. For the first 3 weeks, no sweeping, no vacuuming, no dusting, no Swiffering, none of that. No. The first 3 weeks, they have no. Cooking the first 3 weeks, no, and no. That was an area that I messed up in. You're thinking, oh, I'm just standing over the stove for a couple minutes. No, you can get dizzy. You know, I had that. You can get vertigo. Sometimes going from lying to standing, you can get very nauseous. So no cooking, no light housework at all within those first 3 weeks. A lot of women driving. A lot of women like, I went back to work in 2 weeks. And again, sometimes our situations are very unique, and sometimes we just have to do, you know, what we have to do, which is understandable. And again, these are just overall guidelines. But driving, they have no driving for the first to up to the 5th week. So weeks 4 or 5, no driving. Because again, you're probably still going to be on some type of a pain management regimen with probably drugs or prescriptions that tend to make you very drowsy, very sleepy, sometimes very nauseous. So again, if you can, you know, have a friend, a family member, a spouse drive you, you know, to your post-op appointments or any errands you need to run. These days we've got Lyft and Uber as options, but you definitely don't need to be behind the wheel. This chart says at about week 6, you can go back to driving. The next one on the list is sex. Again, no up until 6 weeks. Around week 6 or 7, they have yes. And again, people heal differently. Some people are faster healers. I am a slower healer. I tend to ask for, you know, whatever my doctor gives me in terms of recovery times. If he tells me 4 weeks, I tend to ask for 6 because I know my body and I know how long it takes me to get up and get going. Again, vacuuming and sweeping, they have it right up there with sex. None of that for the first 6 weeks. I know it seems simple, but again, even though, you know, you have tiny scars in the abdomen, you're like, I can move about, but you're internally, you're still very weak. You're still very raw and sore and tender and sometimes inflamed. So you got to remember what it looks like on the outside. Just like with the diagnosis of the disease, people look and say, you don't look sick, you know, but all hell is breaking loose on your inside. So think about it that way, even in recovery. You know, you're looking good, you're a bit more mobile, but you're still healing, very much so, on the inside. So swimming, they have nope, first 1 to 7 weeks, no. They have here about week 8, you can resume swimming. Heavy lifting, children, groceries, laundry baskets, they have no up until the 12th week. Again, the guideline that was given to me: do not lift anything heavier than a gallon of milk for 12 weeks. I jumped my happy self out there after 2 weeks trying to go grocery shopping, and that did not end very well for me. And again, not sure where all of you ladies live, but now we have things like Instacart. You have Amazon Prime, Amazon Fresh. You have Amazon Prime Now, which will deliver to your home in 2 hours. Again, there's Instacart, there's Peapod. So again, in this day and age, you have options to have groceries delivered to you, and the perishable items, they usually will pack with dry ice. So if you get a delivery and say nobody's home to put away those things, you can let them sit for a few hours in the dry ice. I've done that before. But again, when it came to the laundry, I had my brother walk the laundry basket down to the basement for me. He helped me down the stairs to get my walking in, and all I literally had to do was put the stuff in the washer and in the dryer. He took it out for me and brought the laundry back upstairs. So again, it is essential that you have a good support system in place. And again, if it comes down to it, you've got Amazon Prime and Amazon Fresh. They can deliver the same day. If you need to order some new underwear, order you some new underwear, but it's not worth it, again, to compromise your healing, to compromise your body, to compromise your safety, just trying to get some clean underwear. You're home, you're recovering, put the same socks back on, because you're not having sex anyway. So, if you need to wear your panties an extra day, or, your mesh panties, or, what have you, do it. Do what you need to do, but it's not worth it, slipping and falling and, all of that stuff, trying to do some laundry. Heavy aerobic exercise, they have absolutely not until about the 12th week. Cardio, weightlifting, core work, all of that, again, pulls and compromises on your abdominal area and your core. A lot of times doctors will recommend pelvic floor therapy, which is excellent. I've had it before. I'm definitely planning to have it again to strengthen those core pelvic muscles and alleviate any lingering pain, releasing any tightness and trigger points. I wish I had, if you guys can go online, Google like pelvic floor or diagram of the pelvic floor, and you'll see there's muscles, there's ligaments, there's tissues all throughout the pelvic cavity that need to be worked. Pelvic floor therapy is an excellent resource for that, and my doctor has said that I could start to receive that after week 4 of my recovery, so that by the time I get to week 12, I'll be a little bit stronger and should be able to more effectively engage in those activities. So heavy aerobics, cardio, kickboxing, stuff like that, not until the 12th week. And then finally they have here heavy gardening. Why? Because you're bending over, you're lifting, you're pulling weeds, you've got lawnmowers and, stuff like that going on. So again, they recommend not until the 12th week. And I know it can be frustrating, ladies. But take the time for you, because you'd rather, be careful those first 12 weeks than to do something to hurt yourself and then you be down for another 12 months. It has happened. It can happen. Another note here, again, it says all of these guidelines can vary depending on your surgery, your surgery type, and how fast you heal, which again, I alluded to that every woman is different. But the most important thing that they have here is do not attempt these activities until after you have been cleared by your doctor. That's the most important thing. If you think that you're up for sex in 2 weeks, just have your doctor check. Make sure your stitches have healed. Make sure you are not at risk for tearing. And again, some women do heal faster than others. Everybody's metabolism and healing and immune systems and all that stuff, it's all different. But the important thing is, whatever your pace is or however that works for you, please get cleared, by your doctor first. That is so very important. So just to recap here, just be mindful. Number one, surgery is a process. Endometriosis, adenomyosis almost always involves other organs. For me, it's my uterus, it's my colon, it's my kidneys, it's my liver. So generally there's more than one surgeon working at a time. Things are literally being pushed and pulled and moved. So be mindful about the internal aspect. Laparoscopically, again, those incisions may be tiny. on the outside, but there's a lot that has gone on the inside. So just be mindful of the procedure itself. Be mindful of the anesthesias, the gas, the pain medicines. They can lull you into a false sense of feeling better, or not feeling the significance or the amount of pain that you're actually in. Second thing, don't be in such a rush to, resist that mental urge to try to return back to normal activity, and understand that we have a new normal. Our sense of normal is not like everybody else's, and even from sister to sister and from case to case. Just because you both have stage 4 endometriosis, even then, your normals are going to be different. So kind of resist the urge to hurry up and get back to normal. Nope. Sit yourself down and hurry up and rest, right? It's hurry up and wait, Take this time to read a good book, binge on something on Netflix. You can, take an online class, you can have your laptop in your bed, to browse the internet. But how about do nothing? How about rest? As a wellness consultant and educator and massage therapist, I talk to women all the time. We sleep, but we don't often rest. Take this time to rest. Unplug from social media, unplug from the phone. Just let your mind rest. Physically, spiritually, emotionally, mentally. Just take this advantage of this time and rest. There's some great apps that you can download that can play some great background noise. I have one, I think it's called Ambio, AMBIO. I love all things water and beach related. So there's a great sound of just waves crashing on the beach and seagulls. There's another one that just has constant rain. Those things are soothing for me. You can play that and just take that time to rest. Third point to remember, try to do as much pre-op prep as you can. Paper plates, paper cups, do meal prep, quick fix meals that are microwave and oven friendly. You can prep ahead and store in the freezer or the fridge if you can. Again, see if you can get a support system, get your village, friends, family to help come over with straightening up and cleaning up and things like that. Don't forget about your other options, your Instacart, your Amazon options, even Blue Plate. They'll deliver whole meals and things like that to the home to help you in that aspect. As tempting as it might be to jump down on your boo thing, no sex, ladies and gentlemen, no sex. Guys, don't pressure her. Chill out, chillax. I'm sure you knew how to pleasure yourself before, you got with her. You might have to engage in that for a little bit. Or, how about offer her some soothing massage? It doesn't have to always lead to putting something in something else. Brush her hair, just be present with her, engage with her. Take this opportunity again to expand and expound on what you know to be intimacy. Recreate that. But absolutely, if your doctor says no sex for 12 weeks, please don't engage in sex for 12 weeks. Again, unless, you feel like you're up for it and your doctor has cleared you. Okay? And the last piece, the last two important pieces, you are not lazy. You are not a bum. You are not doing anything. You are resting. You are recuperating. You are healing. Okay? Don't forget that. You're healing. And you have to heal properly. You have to heal completely in order to move forward in being a better you, in order to move forward with having this better quality of life. You've got to heal. You've got to heal. You cannot pour from an empty vessel. You cannot pour from an empty vessel because there's nothing there. You have nothing to give. You can't pour from a cracked vessel because it's cracked and everything that's in is going to seep out. It's going to leak out, So you have to heal thoroughly. You have to heal completely, and you have to heal properly. Or all of the surgery, all the procedures, all of everything, it'll be for naught. And you'll find yourself in a worse position than when you began, and then the healing process is going to take even longer. It's going to take that much more time for you to get back to you, if that makes sense. And then last but not least, ladies, follow your doctor's orders. I know some of us have some great surgeons, Some of us have some not so great surgeons, you know, but ultimately I think whatever guidelines that they give you is generally from their perspective in your best interest. If you disagree or don't think so, talk it out with them. Have that conversation with them. I remember there was one lady in the group that she was afraid to ask her doctor, you know, if she could resume in like masturbation or foreplay or outer play, because she didn't want to wait for sex anymore. If you can't ask your doctor, who's just been all up in your business, looking, searching, cutting, removing things, who can you ask? You know, and yes, the communities are great for support. Yes, I'm an educator and I'm an advocate, but I'm not a doctor. I don't have all the answers. The support groups, we don't have all the answers. Now, there are some support groups that have doctors in them, but even then, that those doctors are not your doctor, and they may not have all the details to sufficiently provide insight and direction for your particular case. So please follow your doctor's orders, ladies, and, you know, we can all heal faster, better, stronger, you know, and come back and continue to fight this fight even more fiercely, you know. So thank you as always for giving me a little bit of your time this afternoon. I hope this provided some value for you. I hope that you were educated, enlightened, and empowered and encouraged. Ladies, you're not alone. I'm in this with you. I go through this with you, but just encouraged to know that it is okay to relax, release. It is okay to let the clothes pile up. It's okay to let the dishes pile up during this time, because this is about you, you know. So I hope that you've been encouraged to not feel bad, to not be riddled with guilt, to not feel useless, to not feel lazy, to not feel important or valuable, because you are, you know. And again, employ as much as you can your village, your team, your squad, your tribe, whatever you're calling them, you know, your friends and family, you know, coordinate a plan with them, those who have kids, if you need help with the kids and the schooling. But don't overexert yourself. Don't do too much too fast. You know, I love all of you guys, and I want us to not just fight these diseases, but thrive with them. And you've got to put you first. It's like the what they tell you about on the airplane. You've got to put your oxygen mask on first before you can tend to the kids or the husband or the people around you. So I'm encouraging you, ladies, when you're having your surgery for endo, for adeno, whether it's hysterectomy, excision, you know, whatever your procedures are, don't lose sight of you. Keep your oxygen mask on first. I know I will be. You know, my surgery is coming up Tuesday, May 1st. So I'm going to try to get in maybe one, maybe two additional videos before then. But I'll be down probably completely maybe that first week or two. So if you don't hear much from me, that's why. Because this time around, I definitely plan to take my recovery much more seriously than I have in the past. Now that I know what I know now, when you know better, you do better. And that's why I'm encouraging you ladies to absolutely do the same. So again, I hope that I've provided some insight for you, probably a little bit of tough love, but I say this from a place of compassion and understanding and love. Go somewhere and sit your behind down, ladies, okay? So that is all for today. As always, I love you guys. If you want to learn more, check out the pages, the posts, the links on Fighting Fiercely for information about endometriosis and adenomyosis. We've got a few more days left in Adenomyosis Awareness Month. So look out for my continued posts regarding that. And as always, you know, be educated, be enlightened, be empowered. Keep fighting this fight. We're all in this together. I love you guys, and we'll chat soon. All right, peace.